Okay, let's unpack this. Headaches. They're incredibly common, right?
Absolutely. Almost everyone gets them.
And for those of us trying to stay informed about health, the question isn't just if it's bad, but, how bad and what do you do?
Exactly.
So today we're doing a deep dive into the medical guidelines, looking at expert insights to help you decode those signals your body might be sending. We want to understand when you should be genuinely concerned about a headache and, well, what doctors are actually looking for.
Right. And we've looked at some really solid sources, the American Migraine Foundation, Johns Hopkins Medicine, the American College of Radiology. Our mission really is to pull out the most vital info about spotting those headache red flags and, importantly, understanding when medical imaging is or isn't needed.
Yeah, because you often wonder, is this just a normal or something serious? And these sources, they really zero in on these specific red flags. It's almost like learning a secret code from your body. Like the thunderclap headache, that sounds dramatic.
It is. It's defined as a sudden, really severe headache hitting its maximum intensity in less than a minute. That's definitely one of those immediate attention-needed signs.
Wow, okay. Are there others?
Oh, yes. What's interesting is how much agreement there is across these different medical groups. Other big red flags include things like new neurological symptoms, think weakness, vision changes, maybe trouble speaking, anything new like that.
Okay, new neurological signs.
Also, a headache that's just getting rapidly worse, either more frequent or much more severe than usual. And then there are specific patient groups. New headaches starting after age 50, or in someone who's immunocompromised or has a history of cancer.
Makes sense.
And one more, a new headache during pregnancy. That consistently warrants attention too. These are all signals that mean, okay, we need to investigate further.
This is really fascinating because I think a lot of us might jump to headache, maybe I need a scan,
That's a common thought, definitely.
But it sounds like the medical consensus, based on these sources, kind of pushes back on that. Like, not every headache needs imaging.
That's exactly right. If we look at the bigger picture, for what are called primary headaches, think your typical migraines or tension-type headaches. If the neurological exam is normal, and there are none of those red flags we just talked about, imaging is usually not appropriate.
Really? Why not?
Well, multiple studies show there's a very low chance of finding anything significant in those common scenarios. And, more testing isn't always better. Unnecessary scans can sometimes lead to false alarms, anxiety, maybe radiation exposure, without a real benefit.
Ah, okay. The choosing wisely idea.
Precisely. The American College of Radiology mentions this specifically. Avoid imaging for uncomplicated headaches.
If a red flag is there, does that automatically mean a scan? Or is it still nuanced?
It's definitely more nuanced, but yes, a red flag changes the calculation. So for that thunderclap headache we mentioned, that's an immediate action situation.
Yeah.
A non-contrast CT scan of the head is generally the first step. It's very good, very quick at spotting things like a bleed inside the skull and intracranial hemorrhage, especially useful early on.
Okay, CT for the thunderclap. Got it. And for the other red flags, like the new neurological symptoms or the worsening headache?
For those, particularly if it's not an immediate life-threatening emergency scenario, an MRI of the head is often preferred. MRI gives better pictures of the soft tissues, the brain itself, so it's better at spotting more subtle issues.
With or without contrast dye?
It can be either with or without contrast. Contrast can help highlight certain things like inflammation or perhaps growths if those are suspected.
And pregnancy, you mentioned that's a special case. What happens then?
Right. For a new headache during pregnancy, given the slightly higher risk of certain things like cerebral venous thrombosis, that's a type of clot, a non-contrast MRI or even a non-contrast CT is usually considered appropriate first. The guidelines generally advise trying to avoid certain contrast agents, especially gadolinium-based ones used in MRI during pregnancy if possible. Sometimes other specialized scans like a CT venogram might be used if they strongly suspect a vein issue.
Okay, so let's try and tie this all together. What's the main takeaway for you, the listener? It really seems to be about empowering yourself by knowing your own body and recognizing these critical red flags.
Yeah, exactly.
Most headaches, thankfully, are benign. They're just headaches. But knowing these specific signs means you understand when it's time to seek medical help, and quickly.
And this raises, I think, an important point, or maybe a question for you to consider. How does actively understanding these differences, when to worry, when imaging is needed, when it isn't, how does that empower you when you talk to your doctor? It really highlights that, well, not all headaches are the same. And being informed, having that awareness, it's probably your best tool for advocating for your own health.